My name is David Barrera. I'm the program director here at Care Integrated Behavioral Health. I've been here since its inception, and prior to that I was an employee of Christus Spohn here in behavioral medicine. I wanted this presentation, to put this presentation together to allow my staff to be heard, some of their concerns and their opinions. The importance is to having a facility in town. And I know that that's a discussion that's taking place as we speak, actually. Come August 15th, the contract ends between Christus Spohn and Care Integrated Behavioral Health. There has to be a plan in place, and I know right now there's no discussion of that, at least not in the public view. And I think that these are the kind of things that need to be discussed in public. If we don't have a facility here in town, these patients are going to have to be transferred out of town to the Valley and to San Antonio. Families need to see their loved ones when they're in a psychiatric hospital and they're in crisis, and they need to visit with them. And most people cannot afford to be traveling to go see people for an hour and a half visit. The other issue I think is important is to mention there's a huge liability for having psychiatric patients waiting in emergency rooms, waiting on medical floors. You know, when it comes to those patients sitting in emergency rooms, you know, my heart goes out to those patients having to sit and wait in those wait times. But it also, you know, I know that there's an important area of police, law enforcement that are sitting and bringing patients, and those patients need to be monitored, but they don't need to be monitored by law enforcement. Our ERs are not equipped to do that, and so many times law enforcement is going to be asked to sit and wait and monitor and hold those people. That's a real safety issue. I've lost friends in law enforcement over the years. I'm a former police officer that were killed in the line of duty, and I can tell you, an officer that's sitting on a patient waiting with them in a lobby in handcuffs could have been that officer that was a block away from helping another officer that was in a life-threatening situation. Majority of our patients are truly indigent. They're insured, but they're sometimes underinsured, and they're our geriatric population. So I just urge you to listen to the voices of my staff and with an open heart make the decisions that you know to be the right decisions. Thank you.
My name is Lena, and I am the program manager here at Care Integrated Behavioral Health. We'll be without adequate inpatient resources in already an underserved community. We're putting them in a situation where they're already a disadvantaged population, a population that is already stigmatized because of their mental health issues, and basically saying, hey, you know, you can't come here, go somewhere else, go to another city, or try to get insurance in order to get help. An increase in number of completed suicides, increase in number of, you know, homicides based, you know, coming from people that are mentally ill. I also think that, you know, law enforcement will be severely affected by not having Memorial Hospital, because they will have one less option for patients to go to. You know, and I don't know if you've ever spoken to law enforcement before in our community, CCPD or Nueces County Sheriff's Department, but they have had some significant issues at other facilities, other hospitals, with taking in patients, getting patients admitted, and that's even for those that are under a mental health warrant.
Hi, my name is Eileen. I am the Director of Social Services over at Spohn Memorial. I have been working in the field of mental health within this community for about 8 years now. Here we deal with a very particular special population. I don't feel like we should take away and continue to take away from the lack of the resources that we already have here. What is the alternative to closing Spohn Memorial? What is the benefit of it? The benefit is to who? It's not to the special population that we deal with. It sounds like it's really a benefit to money and corporations who are dealing with this population. I worked for Christus Spohn prior to working here, and I know that Christus Spohn's ministry, or not ministry, but they their mission is to extend the healing ministry of Jesus Christ. And I think that the population that we deal with needs the healing ministry from Jesus Christ more than anybody in this population. I want to say these things not to ruffle feathers, but to really advocate for people that we serve here and be a voice for them, because they don't have that voice.
Hi, my name is James Christopher Bowles. I go by Chris Bowles. My job title here at CIBH, I'm a mental health tech. If you decide to take away what we're trying to do for these patients, it's gonna affect the population as far as putting these individuals out there on the streets with no place to go to, no help, no services, and not only that, but the crime rate's gonna go up. I hope that you guys would sit down and think about continuing to provide services for these patients.
My name is Diane, and I'm a registered nurse. The psych facility is closing. That's going to be affected the most in our communities. If we don't have a facility like this, there's really nowhere to place them, especially if they're indigent. Bay Area does have a geriatric unit, but it does not care for the type of patients that we look after here. We've had several nurses that have gone to work there, and they tell me that it's a completely different population that they get. So the only alternative for the geriatric patient when they get in trouble is either to go to the Valley, to go to San Antonio, and to go to jail, which has happened with a 76-year-old patient we had about a year ago that ended up spending 2 days in jail, which was heartbreaking for someone that's confused, doesn't know which way is up. So this is a big concern for me.
My name is Deb Allen. I am a CTRS, which translates into recreational therapist. We were here if they needed us. And now I don't know what will happen to them. They need us. They aren't often people with a lot of options.
All right. Hello, how y'all doing? My name is James Spears. I'm an MHT at Memorial Hospital Psych Unit, CIBH. I've been here for 19 years, going on 20. Memorial has been one of the best hospitals in Corpus Christi for a long time. We were the #1 ER unit here in South Texas. Y'all closed it down. Everything went crazy. Everybody went over, tried to go to Shoreline. Shoreline was all messed up. Spohn South was all messed up. Bay Area was messed up. When y'all closed this place too soon, everything in the whole city, the whole freaking city was messed up. We had people inside the emergency rooms waiting in line, sitting there waiting in the hallways to be seen for like 3 and 4 days because y'all closed everything too soon. Because if y'all take us away, we don't have nowhere for our patients to go. Our patients don't have nowhere for them to go. Doctors Regional, Bay Area, all those other places, they can't hold our capacity. Christus is supposed to be a Christian hospital, but I'm not seeing what y'all keep saying y'all are doing. Y'all holler y'all a Christian hospital. Why are y'all trying to close the place when we need to take care of these folks? Christian folks wouldn't turn their back on them. Christian folks would stick out their hand and help them out like y'all always tell us. So y'all need to please help us with this. We can't do this without y'all. And there ain't really too much else I can say that's not going to keep being redundant. And I don't want to be redundant. But please, we do need y'all help to take care of these folks in our city that can't take care of themselves and need our help.
I'm Valerie Alcorta. I'm a mental health evaluator. If they're not stabilized properly, you're looking at suicide. That's sad because we have a over 350,000 people population. So how are up to 14 beds supposed to help?
Good morning, my name is Judy. I have been a nurse for over 9 years. I have been working mainly in the psychiatric population, If these people don't get the right help, they probably will end up in the legal system. So that is my concern about this population.
Hi, my name is Odelia Perez, and I'm an LVN. These patients will actually get lost and forgotten and fall through the cracks.
My name is Marina. I am the psychiatric evaluation service intake coordinator here with CIBH. There's not going to be somewhere here in our community to treat them. I think Nueces County has pushed in the last recent years to do a lot of provide outpatient mental health care, and that's great, and it's there to help, but not having an inpatient facility I think is going to be detrimental to Nueces County given our population that we have here.
Hello, my name is Janie Almeida, and I've been a nurse in the psych department doing utilization and case management for 21 years. I have a deep concern for our population that there is not going to be available beds for them in the near future. And where will these poor people go? It's just very concerning that there is not going to be a place for these poor people. They are the underserved. They are the homeless. They are the ones that no one looks at.
Hi, my name's Karen. I'm an RN. Don't have a place to go. They're either out on the streets, off their medications, and the one place they're going to end up is in jail. That's it. That's the only other option that they would have. They're not going to have their problems fixed. They're going to be a danger to themselves. They're going to be a danger to others. I don't know where these people are going to go, and it's just terrifying to me and upsetting.
My name is John Hill. I'm an MHT. I've been in this field for over 30 years. One of my concerns is when these people have no place to go, who will take care of them? I hate to see what would happen to these individuals if they don't receive the care that they need. They're gonna get incarcerated, or possibly somebody kill them, or they kill themselves. I hope whoever really needs to see this, see it with an open heart as a humanitarian, and what we're gonna do about our people who can't take care of themselves.
My name is Frances. I'm a registered nurse. I have some concerns about this psych facility closing, the people that have nobody at all and they're living in the streets.
Good afternoon. My name is Ray Chapa. I'm a recreation therapist here at Memorial, and I believe that we need to continue with these services. It's absolutely necessary for someone to provide services for these individuals. I feel that we provide a valuable service to the community as well as what's going on with psych closing. We cannot allow this to happen. This is a very important part of our community, and we need to continue to have this going on.
My name is Manuela. I am the behavioral counselor on the geriatric unit. As far as with the others, working with the mentally ill population, those that are out on the streets, the homeless, they are also very much in the vulnerable because I think a lot of them lack those underlying needs and support systems.
Hi, my name is Olivia Perales, and I've been a mental health tech for 32 years. My personal concerns is why these people are not being suited with a psychiatric unit like CIBH had been doing for quite a few years. So I am asking that the psych unit not close due to the need in the society. Thank you so much.